A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Assalamu alaikum.
World Heart Day is observed on 29th of September every year. With a healthy heart, the beat goes on.
All right, our wonderful audience. So that was a brief report to kind of share the essence of World Heart Day. And obviously, when we speak about World Heart Day, it is to raise awareness about cardiovascular diseases. We're very lucky that we've been joined with experts over here who are going to talk about our heart health, how to maintain that. We're asking from them. So we're very lucky that we've been joined by somebody who happens to be a cardiothoracic surgeon at Shifa International Hospital. He is Dr. Asghar Nawaz. Hello, sir. Assalamu alaikum. Good morning.
Hello, thank you very much for the invitation.
And thank you very much.
And
thank you very much for joining us. Wonderful to have you over here.
So we have seen that South Asians are more prone to the heart diseases, right? And that is because we're more prone towards the risk factors, we're more exposed towards them. Do you want to shed light on that?
Yes. First of all, thank you very much for organizing this awareness program, because this is really important, and that's what the Western countries do. I've been there for 17 years.
Yeah,
prevention is where awareness comes in, first of all. So for your audience to understand what are the risk factors, there are certain risk factors which you can change, certain risk factors which you cannot change. So let me tell you first of all, so the main risk factors for heart disease is smoking, diabetes, high blood pressure, high cholesterol level, and obesity, lack of exercise. And in my usual practice, I'm very new to the Pakistan at the moment, but we always used to say to the people for prevention of the heart is you are what you eat.
Yeah.
So you have given this message repeatedly again and again since the start of this program, and this is the real message which needs to go to the people. First of all, look at what you're eating, and secondly, do you really need all that? So you need to consume it. Like my colleague said, we need to do exercise, we need to go to the gym. We need to find the ways to keep our heart under control. Now that's one thing. Second thing is the control of these risk factors. If you have any of these diseases already, then obviously take regular medication. If you don't, then adopt the measures for them not to happen in you.
True.
And I said there are certain risk factors you cannot change. And one of the important risk factors in heart diseases is the family history. That is the only one you cannot change.
True.
So obviously you don't have a control in that, but for the rest of it's exercise, it's diet, and the control of your other.
Exactly. And sir, in addition to that, what I would certainly want to ask you is to draw a comparison, because alhamdulillah you had practiced, outside Pakistan too as well. You happen to be a surgeon. What are the most common surgeries taking place when we talk about heart surgeries, in the West? And when we, since you're here already in Pakistan, what are the most common illnesses over here which really need to end up being with the surgeon too as well? So please go ahead.
Yeah. So, the disease pattern are probably similar. Is the frequency which matters. Now we have relatively shorter life expectancy in this part of the world.
Unfortunately.
And there are reasons.
अच्छा जल्दी जान छूट जाती
है. And the other thing is also the most common problem which we face here is the ischemic heart disease, as Dr. Ali mentioned. That's the most common problem. The other problems which are in the heart diseases for which we have to do intervention like operations is the valvular problems. Now the valvular problems, there are two kinds of problems. One is called the rheumatic, when you have some rheumatic fever when you have childhood, and the other is degenerative. Now the degenerative usually comes at a later stage, and as I said, we don't have a higher life expectancy, we probably don't reach that. So my most common operation here is the CABG, coronary artery bypass grafting, which is for the narrowing of the blood vessels which supply blood to the heart itself.
Exactly, and that's really very common over here as well. And I want to talk about, how, even whether you need a stent or not, eventually, it is for the well-being of our audiences as well. But now moving on to you, Dr. Saab. Now what I've seen is, since, I think Hajra posed a very important question, because, climate change is taking a toll. We cannot keep ourselves hydrated as much as we used to. The temperatures are changing. The working practices are changing. But what I have witnessed is that, in some cases post-COVID, what I've seen that people who've actually taken steroids to get out of COVID, they ended up with atrial fibrillation. There were other issues which were related to lungs in the first place, but that virus or, infection, in fact, went onto your heart and then it created problems. Do you think that there is a safe way back home with atrial issues like atrial fibrillation, and what are the other issues associated with post-COVID symptoms? Can we please talk about it a little?
Yeah. So mostly when the COVID was on its peak, I was in the UK at that time. That was March 2020, and mostly we would see people coming with the lungs problems, breathing problems, and the changes we will see was everything was affecting was within the lungs. People were ending up going on to the ventilator and stuff. There was hardly any evidence initially for any problems related with the heart or any other organs in the body. But later on, then we saw it's actually more widespread. So it's not a organic disease which is limited to one organ, but it's a multi-organ disease, because we saw people coming with the problems in the brain, GI, people coming with the clots in the arteries, in the legs that would travel up, giving a stroke to the people. In terms of the heart itself, we haven't really come across. But the only thing we saw is that when someone's, because the lung and heart, they're interconnected.
True.
Now, me being a cardiopulmonary transplant surgeon, which means I do the transplants for failing heart and lungs. So we know that these are very interconnected. So anything which affects the lung can potentially affect the heart, and the other way around.
Exactly.
So if we have seen this. In terms of arrhythmias can happen because of any reason, and atrial fibrillation is one type of arrhythmias as well, which is the heartbeat goes irregular and maybe faster and slower.
Yeah.
And that gives symptoms as well as also gives the hemodynamic compromise, which means your blood pressure may go down and you may not feel well. So as a result, we have to treat these. Mostly they are treated by the medication. We reverse them into sinus rhythm, which is the regular heartbeat. Sometimes we have to do intervention in the form of ablations, which is through putting some catheters.
Okay.
Rarely, when this persists and is resistant to all these treatments, then we have to do surgery. But due to COVID, I don't think we have seen this as a common phenomenon.
Okay, lovely. So, Dr. Saab, coming back to you.
The Pakistanis already know about it. For people who never knew about it, Dr. Saab has actually stated it once again.
Right.
But sir, one last thing towards the end, that is that over here, unfortunately, I'm not talking about each and every cardiologist or a cardiac surgeon, but yes, the ill practices are going to exist in every community and society, where you've seen cases where people who were absolutely perfect were tricked by doctors to getting into stents too as well. And when we talk about stents, what the problem is that, they would say that you actually have to get it from this pharmacy. It's going to come from a German-made company. And, how would we know, what a German-made company is? So it ranges from 500,000 rupees to at least 100,000 rupees, where a stent, I believe, originally cost somewhat around 14,000 or 15,000 rupees only. So why do you think that we're making it difficult for people to even get a treatment? For people who are ill, they require it, and for people who do not require it, but the doctors still give it to them, please.
So I think your question is mostly related with the ethical practice and the non-ethical practice. Now, a layman, being a layman, wouldn't understand, because this is a very specialized area, and sometimes it's actually the very specialized, which is the cardiologist or the cardiac surgeon would actually know. Not any other specialist would know about the thing. In medical practice, the ethics comes first. We were taught this when we started as a medical graduate. When I was in the UK, we had the manifesto. First of all, it is that you do no harm. That's the main thing. You do no harm to the patient, because the patient would trust in you. They give you your bodies, and then it's you who has a control on it. And that's where your all ethical considerations come into. To regulate these, we have bodies like Pakistan Medical Commission. We used to be Pakistan Medical and Dental Commission. So now they are the regulatory bodies who look into generally oversee all these practices, and all these doctors are registered with these. I'm relatively new to the country. I can tell about my institute, the Shifa International Hospital. We have a very robust mechanism in terms of when patient comes in, is seen by the cardiologist, he gets intervention. The cases do get discussed, what we call as the MDT, which is a multidisciplinary team. And then after that, if there is any problem, like any morbidity or mortality, like if the patient dies or has any risks or complications, then it gets discussed in those meetings as well. As a result, there is a check on to the physicians. So it's those physicians who can check on themselves or their colleague can check onto them. Unfortunately, the layman person has to just trust them. But at the same time, I would like to warn my colleagues as well, with this technology nowadays and people surviving longer because the information technology is everywhere. When they come to me, they actually know everything about me. I get surprised. When I came to Pakistan, I thought no one knows me. But when they actually come to me, they know much more about me. So people do search about, they go and consult other people as well, and they translate into like the mashura karna sunnat hai and things like that, which is fine. I think things do come up, the negative practice will come up onto the surface. As a result, those physicians are ruining their own career.
Exactly. Thank you very much for saying that. It's way too clear. But thank you very much, for sharing with us that, that such checks and balances are in place. Thank you very much, Dr. Saab, for being with us, both of you. You were lovely early in the morning for giving us a lot of input on how to actually keep your heart healthy. Well, what I believe is, you really need to keep yourself as your top priority. Love yourself. Love everybody around you, and that's something, because where the theme actually says use heart for every heart, I think, and when we talked about the 3 pillars, it said that you really need to use your heart for nature. That's something which we will be talking about in the next segment, ladies and gentlemen, so don't go anywhere. We'll be right back. Good morning.